Hello everyone, you are watching ITV Gold and I'm your host Aditi Lamba. Welcome to our special report this hour on COVID-19 impact and information. Right now we're being joined by Dr. Rachana Kulkarni. She's joining us from Princeton, New Jersey via Skype. We're looking forward to getting more information on COVID-19 and also the impact of COVID-19 on heart patients and a sudden surge of COVID patients and cardiac issues that we have seen so far. So let's welcome on the show right now. We have with us Dr. Rachana Kulkarni. Thank you so much for joining us.
Aditi, thank you so much. Thank you to you and ITV for giving me this opportunity. Always a pleasure to be here.
Of course, and it's always a pleasure to have you. Dr. Kulkarni, you're a cardiologist and you're also the president for American Heart Association New Jersey chapter. I have to ask you, just starting this off, COVID-19 has created an abundance of fear and there's an abundance of advice, there's an abundance of measure. What is your strict advice as a leading medical professional right now for all of the viewers watching?
COVID-19 has gripped the nation like wildfire. Means today we know that it's over 750,000 patients who are diagnosed, who are diagnosed globally, and over 160. When I checked the figures last time, 160,000 have been affected in the United States, and sad to say that 3,000 so far have succumbed to this. And unfortunately, New York and New Jersey have become the epicenter of this epidemic. Yes. It's scary times, but a lot of COVID can be prevented if we take certain measures. And I would really like to focus on what can we do to prevent this epidemic. Can we do things simply? COVID is a virus.
Right.
And as we know, there is no definite treatment for a virus yet. However, there are simple measures that we can do. Some drugs such as hydroxychloroquine and possibly azithromycin have been shown to have some beneficial effects. Right. But we in medical profession know that what really works is a vaccine, which is probably some ways to go. Yes. So we cannot rely at this point just on medications. We have to see what we can do to destroy the virus. And it's fairly straightforward, actually, when we look at that, washing our hands with soap and water, because the virus has a lipid cover on it. And if the lipid cover gets destroyed, the virus is unable to propagate. So hence, washing our hands strictly, at least for 20 seconds, with soap and water can disable or can destroy that lipid coat. So that's very important, and I cannot overemphasize the importance of that. So wash your face, wash your hands, and wash in between your thumbs, because this is where this is an area that can get overlooked. Another very important thing is stay away from jewelry. Rings, if you have to have your wedding band, wear your wedding band, but no other jewelry. Also, try not to have earrings, anything in the neck, just because those can be places where we don't touch, we don't clean, and viruses can stay. So that's another simple thing. It's a virus that propagates with droplet transmission.
Right.
So keeping safe distance, 6 feet between us, and social distancing is very, very important.
Right. So
remembering, go ahead.
Go ahead.
We, especially South Asians, we are very family-oriented people. We want to stay together as a family, but it's very important to practice hand hygiene and social distancing even when you're living together.
Yes. Definitely. So, just in terms of that, doctor, there has been such a huge, massive campaign basically that we've seen in media, especially this week, on the importance of social distancing. We're calling out on young individuals that are still out on the streets of New York and New Jersey, people that are still going out. All of the professionals are telling them to stay inside, to stop the spread, to save lives. Your comment on people that are choosing to still go outside, what can we tell them?
Stop. That's my only comment to them. It's, why invite trouble? You absolutely have to stop. Keep in mind, we don't have a definite treatment for the virus yet. So we have to do whatever we can. And stopping to go out unless it's absolutely necessary.
Yes.
Go online, order whatever you need online. Keeping safe distance, keeping social distancing. And a lot of times, even if you want to care about not visiting your elderly, sick relatives, elderly relatives, because you are exposing them, it's very important.
Yes, for sure. And Dr. Kulkarni, you are treating COVID patients right now, as we spoke earlier on it. Could you give me an insight into the intensity of the cases you've seen? Perhaps if we can, present a picture to our audience as to what is happening to some of the very intense cases of COVID. I'm not sure if you've seen any of those, but if you can give us a little picture of, how big the concern is, perhaps we can, address the social distancing even more.
Concern is real. Emergency rooms are flooded with patients who are presenting with cough, cold-like symptoms. And keep in mind, a lot of COVID symptoms that we were thinking we knew about a week ago, things are evolving. This is a moving target because now we know that people can have just GI symptoms, some nausea, some diarrhea. They come, we look at them, we treat them, and now we know that they're positive for COVID. By that time, they've already been exposed. And a lot of emergency personnel, a lot of medical personnel have been exposed to them. So the strain on the healthcare system is real because once a patient exposes to a healthcare professional and that person is positive, then that person is off duty for next 14 days. So the strain on healthcare system is real. The need for PPE is real. And unfortunately, the need for ventilators is real. Most hospitals, at least the 2-3 hospitals that I serve at, are at maximum capacity. We don't have a lot to spare. The ER is full, and unfortunately, the intensive care units are full of COVID patients struggling for their life with ventilator support. And I have to say that some of these patients are not your typical high-risk individuals. They are young patients who have not had any predisposing conditions. So I think this is an equal opportunity killer. So please take care of yourself. Practice social distancing. Don't go out if you don't have to, and maintain hand hygiene.
Definitely. And you just reflected upon PPE, doctor. That's a question that I'm consistently asking each doctor to give their own personal experience and own personal comment on. Have you seen this disparity yourself personally of the amount of lack of PPE we keep on hearing about?
I'll give you an example. Simple. When we would go to the hospitals, or whenever we go to the hospital, if we have to enter a patient's room, if they have what we call in medical term contact isolation, that these people can be contagious, so we have to go in. So we would put on a mask. When we come out, we take the mask out, right? And we would go through these because there were so few people with contact isolation. Now that is changing, and we have started seeing rationing of the masks. A lot of practices, a lot of places are just giving one mask per day per healthcare person. And that is because we are all afraid that we are going to run out of it. And we are not even talking about N95 masks. We are talking about surgical masks. We are talking about gloves. So simple things. So the PPE shortage is real.
Wow. And who do you call out for on that? Has there been any kind of efforts made by you and your team also to sort of get more PPEs? I know some people are hoping for more donations. We just spoke to the Brooklyn Borough president, who was actually himself with his team delivering some of the PPE that was donated to hospitals and other centers. What's going on in New Jersey about it?
In New Jersey, there is, thanks to a lot of organizations, people are coming forward and donating PPEs, which we are very appreciative of. And also, a lot of businesses, my compliments to them, have changed their operations to make PPE, especially masks, N95, and surgical masks, and so that we can order from them. And there is a wait list. I can tell you, for my own practice, I ordered some,
Yeah.
and I have taken a number on the line, just like a deli counter,
Oh,
that
wow.
most big hospital systems have taken the supplies, and we are in line to get our share.
Wow. If I was to ask you to make an appeal for, donations of PPE or for people that may have that access, what would you say to them?
Please go in your garage, please go in your basements. We all may find some masks, especially if you're painting your house or if you're planning to, you may have some N95s. So please consider donating it to your local health organization. We will thank you from the bottom of our hearts.
Yes, and I'm sure it'll be great if you can get even more. I want to take this part of the interview to discuss a more and more in-depth perspective on COVID-19, to just get that perspective out. So when we're talking on having this in-depth perspective, Dr. Kulkarni, you are a cardiologist. You're also the president for the New Jersey chapter of American Heart Association. Have you seen a surge of cardiac relation with COVID? I know there are a bunch of new studies coming out which are saying that at high-risk patients who have heart diseases or who have other diseases, chronic conditions, may be susceptible more to COVID. How has your experience been hosting, both those kind of patients, if we can get some more perspective into it?
Of course. Aditi, people who have heart conditions, who have congestive heart failure, who have had heart attacks or compromise with high blood pressure, diabetes, heart conditions, specifically with congestive heart failure, they are considered high risk for heart disease. So they have to be extra careful, and that's why I say to the family, sometimes caring is not visiting your relatives with such conditions. They are definitely at high risk. If you see the example of Italy, most people who succumb to that disease, a majority of them were people over the age of 80.
Oh, wow.
And just because the propensity of heart condition is very high risk in these people. Another
Definitely.
interesting fact which has started surfacing now is, as you know, we initially thought that COVID is a disease of acute inflammation and acute respiratory syndrome in the lungs that makes the lung hugely inflamed, and there is this cytokine storm or surge which causes acute inflammation in the lungs. What we have started finding now is that inflammation affects the heart as well, and we have started seeing people who were discharged, who felt that they are getting better for COVID or were at least over the initial hump, and then they suddenly present with acute congestive heart failure like symptoms, and we think it's because of the myocardial, meaning heart muscle involvement with the acute inflammatory reaction with COVID. So we are going to see that more. And people, keep in mind, people who have already compromised cardiovascular system
Yeah.
are more likely to feel the effect of that or will have detrimental effects. So we have to be very careful.
Doctor, South Asian Americans and South Asian community in general carries a really high risk of having these heart diseases. And I'm sure you must see many patients from our own community in the same regards. When we're looking at these patients that are on medication currently, that are in treatments right now, how should they look at COVID? We've actually had concerned patients ask us, what should they do since South Asians are such prime carriers of these heart diseases and chronic conditions? Your comment on that?
My two pieces of advice that I would like to share with our community is South Asians are at very high risk for having heart disease. So we have to be extra careful. Second thing is please take your medications regularly. You're at high risk for having heart disease. Do not ignore. Just because COVID is here upon us, heart disease doesn't go away. Every day we are treating patients still with heart attack and congestive heart failure and irregular heart rhythm. So that doesn't go away. Most of the doctors have fortunately switched over now to telehealth.
Yes.
So please follow up. Please take your medications regularly. And if your physician is offering telehealth, if your physician is offering, please have your follow-ups. Please make sure you keep up with your medications and your appointments to minimize your risk for COVID and increase your chances of surviving it.
Definitely. I truly appreciate you for giving us this insight, Doctor. We are coming towards the close of this part of the interview. My question to you is, we're talking about flattening the curve. We're talking about reaching a stage where, we could be more secure, we could be more safe, even outside. How do you sort of look at the next coming week for yourself when you are practicing, doctor, you are in the front line? How are the next few weeks going to turn out?
I hate to say this, but we haven't seen the peak of this epidemic yet. I think the next 2 weeks we are going to see a surge in this, and I'm really concerned, and that's why I would urge people to stay indoors, try to flatten the curve as much as they can, because we haven't seen the worst of it yet. And what Dr. Fauci said, 100,000 deaths, I think, unfortunately, it's a conservative estimate, and we need to do our part in containing this pandemic.